My name's Mr. Daniel Allison. I'm from Cleveland originally, but I've just moved back in the area from with work. I've been working across the world as a fashion photographer. I'm 38 now. When I was 18, I broke my small toe on my right foot. I've had problems ever since, really, but nothing really too serious until about 2 years ago when I was actually outside of the country, when my toe was actually kept being dislocated and staying out the joint the whole time. So I used to just wrap it up and go to work, and I knew something was wrong, but I was waiting to come back to the UK to actually get something seen to, obviously, because I was working out there. So I went to go and see Mr. Murphy at Whitegate Drive through my GP, and it was really interesting because he knew instantly what the problem was, literally within about, 15-20 seconds probably, before I'd even had an x-ray. And he said it looks like it could be a combination of a hereditary and an injury that I'd sustained when I was 18, and it caused a tailor's bunion, which was basically the bone, the fifth metatarsal was growing out and it was pushing the toe in, and that's what was causing the dislocation. And there was only two options: surgery or to wear like a plastic spacer in between the toe for the rest of my life. And I was like, okay, I'll go for the surgery, please. The day of the surgery, when I woke up at home, I was actually quite anxious, to be honest, but sort of mixed with excitement as well to get it underway and get it fixed. But as soon as I went in, it was a completely different vibe that I had before. That they seem a very sort of close-knit group, from the receptionist to the anaesthetic. You know, the whole group seem very together. They don't seem like separate, and they're all sort of, I wouldn't say like they weren't having a laugh together, but the atmosphere seemed quite fun, but in a professional way. And I'm pretty sure that was to kind of keep me calm and make me feel sort of involved in what was happening, you know what I mean, rather than being separate. I forget her name. She acts as the receptionist and secretary there as well, but she was next to me, and she was great. I mean, I could tell that she was really experienced in sort of like keeping people calm. At that stage, I was really calm anyway, because I'd been given a sedative tablet, so I was kind of all right anyway. But she kept asking, you know, is everything okay, you know, and I just kept saying, yeah, it's absolutely fine. And I was a bit drowsy, so I'd just put my headphones on for a bit and then would take them off. She would bring me a blanket when it was too cold. It got a bit cold in there because obviously the environment, I guess, to stop bugs or something. So she brought me a blanket, but she was absolutely great. She was great. Surgeons were great. They were just talking very casually and professionally amongst themselves. Yeah, absolutely perfect. After the surgery, I was wheeled out to another area where Mr. Murphy then came and told me the procedure again, what had been done and what he'd done technically, and that it was straight, and I had a look and it was absolutely straight. You know, my toe was completely straight. And then they left me for about 15 minutes to come round, I guess, just from the sedation tablet. And then he brought me a coffee. A coffee came, so I sat there waiting, and he brought me a coffee. Had that, and then they phoned my partner, came to pick me up, and I literally left with information. You know, don't walk on it now for I think it was 12 weeks. It was something like that. But to go back after 4 weeks to have the cast removed. So I didn't walk for 4 weeks. I was like absolutely no contact whatsoever. Went to go and see them. They cut off the cast, put a new cast on, had a look, make sure there's no infection, things like that. That's when I got to see my foot for the first time, and I was expecting like something, you know, like from a horror movie, but it was so neat, it was so perfect. There wasn't any swelling. It was great. First of all, a massive thank you for fixing the issue, which, you know, has been dragging on for, you know, almost, you know, like 20 years almost. Basically just giving. When I saw Mr. Murphy last, I explained to him that my gait has sort of changed with the foot, and he sort of laughed and was like, oh, you know, I'm not so sure about that, but it's definitely changed the way that I walk. I don't sink in now, and it's alleviated a bit of pressure on my back. Now I don't know if he knew that would be, you know, like a side effect of that, but it's fixed, so I can do nothing but sing praises for the way he did the surgery, the way his team made me feel, from right from the beginning right to the end, and it's ongoing now. You know, I went to see him 2-3 weeks ago for my 6-month check-up. You know, just I can't really fault any stage of it, to be fair. So just a huge thank you.
Just wanted to say a very big thank you to Daniel for his very kind words on his piece on the internet. It's a pleasure to operate on patients in general, and particularly Danny did a really good job in his post-op period. He went along with all the post-op instructions, his recovery went without event, and ultimately had a good outcome following his surgery. I audit all of my outcomes following surgery, but it's really, really nice to hear individual patient reports on exactly how well or otherwise they've done.